Hello, class. Thank you for taking the time to review my presentation on schizophrenia. I'm Sophia Sestero, and I look forward to explaining the neurotransmitter theories of schizophrenia and the treatment methods used to alleviate symptoms in those with the disorder. Individuals who have schizophrenia typically experience symptoms such as hallucinations, delusions, and troubled thought patterns. Hallucinations experienced occur without any external triggers, they are solely internal. These can include seeing things that are not present or hearing voices that do not exist. Delusions that individuals experience are strong false beliefs, such as the belief that the person is able to read minds or that other people are plotting against them. The troubled thought patterns individuals experience can involve issues focusing and organizing thoughts. Schizophrenia is typically diagnosed during early adulthood, typically during the 20s. Now, next, let's consider the neurotransmitter theories of schizophrenia. The three most prominent neurotransmitters that influence the symptoms of schizophrenia include dopamine, glutamate, and serotonin. Dopamine plays a role in the onset of both positive and negative symptoms of schizophrenia. The overactivity in the mesolimbic pathway is linked to positive symptoms such as hallucinations and delusions. On the other hand, underactivity in the mesocortical pathway is associated with negative symptoms, including reduced motivation and emotional expression. Glutamate plays a role in the development of schizophrenia-related symptoms due to the hypofunction of NMDA receptors on the GABAergic interneurons, which cause the overactivation of dopaminergic pathways, causing some of the positive symptoms of schizophrenia. In those with this disorder, the dysregulation of serotonin involving the 5-HT2A receptors can influence the release of dopamine. The imbalances of these neurotransmitters can cause the onset of both positive and negative symptoms of schizophrenia. Second-generation antipsychotic medications have been found to be more effective in treating those with schizophrenia, therefore making them the typical first choice in treatment medications. These medications work by blocking the D2 and serotonin receptors, which provide control to symptoms in the patient more effectively than other antipsychotic medications. Although they are known to be the most effective treatment method, second-generation antipsychotics can cause side effects. The most common and notable side effects that individuals experience are weight gain, hyperlipidemia, and diabetes mellitus. Each of these side effects should be closely monitored as they can cause long-lasting detrimental issues for the patient. In addition to medication-based treatments, non-pharmacological treatment has shown to play a vital role in the betterment of schizophrenia-related symptoms. There are different forms of non-pharmacological treatment methods that are effective when treating schizophrenia. Individual counseling, which provides the patient with individualized treatment that is tailored to their symptoms. Group counseling offers the patient an environment that is supportive and allows the patient to learn from others with the same condition. Lastly, cognitive behavioral therapy helps the patient to identify their troubled thought patterns and address them directly. This form of treatment can be used alone or alongside a pharmacological treatment. Regardless of the chosen treatment method, there are both benefits and risks associated with the treatment of schizophrenia. When using medication to treat schizophrenia, the patient will likely experience a reduction of the negative symptoms associated with it, an improved quality of life, and improved social functioning, though they would also endure risks associated with these medications, such as tardive dyskinesia, weight gain, diabetes, excessive drowsiness, and a heightened risk of mortality due to cardiovascular problems. If the patient was to choose not to use medication in their treatment, they would also experience risks and benefits associated with a lack of medication. Benefits would include the lack of negative side effects for medications and a focus on talk-based therapy. The risks they would encounter would include the persisting of schizophrenia-related symptoms and a heightened risk of suicide. Our understanding of schizophrenia is complex and revolves around the interactions of the neurotransmitter systems of dopamine, serotonin, and glutamate. Understanding the ways in which these neurotransmitters are involved in the onset of symptoms of schizophrenia allow us to accurately formulate treatment plans that best treat the symptoms associated with the disorder and allow providers to create personalized treatment plans that best suit each individual patient. Thank you for your time and attention throughout my presentation.